Cytolog Misoprostol. Each tablet contains Misoprostol 200 mcg. Product complies with pH specifications. Pharmacology. Misoprostol is extensively absorbed and undergoes rapid esterification to its free acid, which is responsible for its clinical activity and, unlike the parent compound, is detectable in plasma. Maximum plasma concentration of misoprostol with acid are diminished when the dose is taken with food, and total availability of misoprostol acid is reduced by use of concomitant antacid. Antacid. Misoprostol has both anti-secretory inhibiting gastric and secretion and in animals mucosal protective properties. Antacids inhibit prostaglandin synthesis, and deficiency of prostaglandins within the gastric mucosa may lead to diminishing bicarbonate and mucus secretion and may contribute to the mucosal damage caused by these agents. You may read more information in this image. Now, mode of action. Cytolog misoprostol belongs to a group of hormones called prostaglandins, which can cause uterine contraction and ripening of the cervix. Although prostaglandins are highly effective, their efficacy depends on number of prostaglandin receptors in the uterus, and this varies according to whether the woman is pregnant and what stage of pregnancy. At the end of pregnancy, there are many receptors, and a small dose of misoprostol leads to strong contractions. Indications. Gynecological indication in the prevention and treatment of postpartum hemorrhage, labor induction, and unfavorable cervical conditions. Anti-ulcerant indication. Cytolog misoprostol is indicated for reducing the risk of NSAIDs, non-steroidal anti-inflammatory drugs including aspirin, induce gastric ulcer in patients with high risk of complications from gastric ulcer, the elderly and patients with concomitant debilitating disease, as well as patients at high risk of developing gastric ulceration, such as patients with history of ulcer. Cytolog misoprostol has not been shown to reduce the risk of duodenal ulcer in patients taking NSAIDs. Misoprostol should be taken for the duration of non-steroidal drug therapy. It had no effect compared to placebo on gastrointestinal pain and discomfort associated with NSAIDs use. Dosage and administration. Gynecological dosage and administration is postpartum hemorrhage prophylaxis according to the United States Pharmacopoeia, 400 mcg to 600 mcg orally or rectally immediately following delivery of the child. Postpartum hemorrhage treatment. According to a clinical study, 600 mcg orally or 1000 mcg rectally or 200 mcg orally with 400 mcg sublingually. If cytolog has been given as prophylaxis for PPH, or repeat dose of cytolog should not be given unless at least 2 hours have elapsed since the first dose. Induction of labor. According to the clinical studies, 25 mcg vaginally for hourly, maximum 6 or 50 mcg orally for hourly. According to the World Health Organization (WHO), 25 mcg vaginally for hour, maximum 6 hours. While you may see the dosage for anti-ulcerant dosage in this image that shows on your screen. Adverse effects. Adverse effects including gastrointestinal, gynecological, and elderly. gastrointestinal (GI) disorders had the highest reported incidence of adverse events for the patient receiving this preparation. It can cause more abdominal pain, diarrhea, and other GI symptoms. The incidence of diarrhea can be minimized by administering it with food by avoiding co-administration with magnesium-containing antacids. Gynecological disorders such as spotting, cramping, hypermenorrhea, menstrual disorder, and diarrhea have been reported. Postmenopausal vaginal bleeding may be related to misoprostol administration. Elderly. Overall, there were no significant difference in the safety profile in patients 65 years of age or older compared with younger patients. Contraindication. Misoprostol should not be taken by pregnant women to reduce the risk of ulcers induced by non-steroidal anti-inflammatory drugs. Misoprostol should not be taken by anyone with a history of allergy to prostaglandins. Precaution and warning. Precautions should be taken in conditions where hypertension might precipitate severe complications, example, cerebrovascular and cardiovascular disease. Drug interaction. There is no evidence of clinically significant interaction between misoprostol and cardiac, pulmonary, and CNS drugs and NSAIDs. Bioavailability of misoprostol is decreased with high doses of antacid. Use in pregnancy and lactation. Because of the abortifacient property of the misoprostol component, it is contraindicated in women who are pregnant. It should not be used in the woman of childbearing potential unless the patient requires non-steroidal anti-inflammatory drugs therapy and it is at high risk of developing complications from gastric or duodenal ulcers associated with the use of NSAIDs. In such patients, it may be prescribed if the patient has had negative serum pregnancy test within 2 weeks prior to beginning therapy. Is capable of complying with effective contraceptive measures, has received both oral and written warning of hazards of misoprostol, the risk of possible contraception failure, and the danger of other women of childbearing potential should the drug be taken by mistake. Will begin it only on the second or third day of the next normal menstrual period. Excretion of the active metabolite misoprostol acid into the milk is possible but has not been studied because of the potential or serious adverse reaction is nursing. It is not recommended for use by nursing mothers.